Hi everyone, my name is Rhonda Bradley. For those of you who don't know me, I'm a registered respiratory therapist and I've worked with SCAD over the years for clinical education, for ventilation, and all things respiratory. So your team has asked me to put together a quick just-in-time video regarding the use of HME-Fs or HME filters. So just a refresher, for those of you who've been to my ventilation classes, I know that term should be familiar to you. So what is an HME-F? HME stands for heat moisture exchanger, and that is a device that is typically used with intubated patients, and it allows the device to catch the patient's own exhaled heat and humidity, and then upon the delivery of the next breath, it delivers that heat and humidity back to the patient. So its primary use for an HME is to keep the airway from drying out, having cold, dry gas blowing into the airway via a resuscitation bag or a mechanical ventilator. Okay, an HME-F, the F part stands for filter, and that is a HEPA or microbacteria and viral filter that is incorporated inside of the device so that it's also used for filtering capabilities and qualities. So you guys are going to be getting some of these. There are different types and sizes that are available to you while procurement looks for a standardization. So yours might not look quite exactly like this. It might be a little bit different shape or a little bit different size, but they do all work the same. They have all the same filtering capabilities, as well as the end connections are the same on all of them. So they will all work in the same way. Okay, so let's talk about where you would put that in. So let's say, for example, you're getting ready to intubate somebody in your bag mask ventilating. What you would want to do is just connect your HME-F in line with your resuscitation bag and your mask. Okay, so at this point, while you're bagging your patient, you do not have a complete seal, right? Because if this mask moves away from the patient's face or gets dislodged from their face and you're bagging, you do still have the ability to spread particulate. So that's why it is absolutely important that you continue to wear your N95 for your own protection and for the protection of yourself from others, is to wear that N95. So you are going to still need to do that, of course, but this, as long as you have a good seal in the patient's face, this will prevent splatter of aerosolized particles coming back through the bag and out the exhalation valve. Okay? What about once the patient is intubated? Well, once the patient is intubated, we're just going to remove the mask. We've got our ET tube here, and we're just going to connect right onto that ET tube. All right? So assuming that our cuff is inflated, we do now have a closed system, so we can go ahead and bag that patient, and all air is going to be coming in and out through this filter, so it is going to be filtered before it escapes out that exhalation valve on the resuscitation bag, protecting you in the safe space. Still not a reason to not wear your mask, but definitely increases the protection significantly. Okay? What about for a patient that we're going to use the ventilator on? So again, if they're intubated, you're going to go ahead and leave that connected to the ET tube, and then you're just going to be connecting at your green swivel right to your ventilator circuit. Okay, this will actually fit directly on from the ventilator Y without the green swivel, but most of the time you're going to want that green swivel on there for a little more flexibility. Okay, what if you're going to do non-invasive ventilation? So this is somewhat controversial, and a lot of places have not been using non-invasive ventilation until just recently, because people were afraid of the aerosolization of the patient's own exhaled air and potential contamination of the caregivers. If you have the kind of system that you guys have, that is the closed system with the blue elbow on the mask, which is what you guys use for both CPAP and non-invasive ventilation, it is a closed system. So all air is being delivered through the ventilator circuit to the patient and then back out through the expiratory limb and is being exhaled through the exhalation valve on the ventilator circuit. So as long as you have a good seal on the patient's face, you do not have a chance of spreading the aerosol. Now, if the mask does come loose from the patient's face, of course, there is the potential for cross-contamination. Again, that's why you're always still going to wear your N95 as well, okay? And this can fit in line this way, or as you guys remember, you sometimes might want to set this up without the swivel so that it's just directly in line with the patient's face like this. That is fine as well, okay? The only time this gets a little bit complicated is if you are going to be giving an aerosol treatment at the same time, okay? So again, aerosol treatments have been somewhat controversial as well. In fact, you may have heard that many hospitals have switched all their patients over to meter-dosed inhalers so that they do not have that potential of aerosol particles in the direct line of the caregivers. That is a little bit more difficult to do in EMS because it's the meter-dosed inhalers are full inhalers and are only single patient use. So if you do need to give an aerosol treatment, let me show you how you would do that. So in this situation, you're going to take your HME-F out of line from right at the airway because we need to give albuterol, right? And if we put our albuterol in line, we'll just be spraying it into our HME-F. So we're going to put our HME-F on the expiratory limb, all right? So on your circuits, that is the side that is the most difficult to disconnect, okay? So if you know you're going to be giving a treatment, you might want to, before you start, put the circuit on the patient, you might want to wiggle that around just a little bit and get it loose so that you have the ability to disconnect it fairly easily when you're ready to do that and put your filter in place here. Your aerosol treatment, of course, is just going to go straight in line on the inspiratory limb, right? So your setup, whether the patient is intubated or mask ventilated, would look something like this. Inspiratory limb, okay? Aerosol treatment, so albuterol is being delivered to the patient. And then on exhalation, they're exhaling out the other side. It goes past your filter. You're not using it as an HME right now. You don't need to because you're giving them an aerosol. You're only using it as a filter. So the filter is on that expiratory limb between the Y and the circuit, okay? And then it protects you as long as the mask is on the face. Or again, if it's an intubated patient, you now have created a closed system. So you're absolutely protected as long as everything is connected, okay? So just remember that HME-F is going to be there to protect you whether you're using a resuscitation bag or any type of ventilation with a ventilation circuit, okay? So everybody, hopefully you can get started using those right away. If you have questions, you can pose them to your education team and we can get those answered for you just as quickly as possible. All right, so hopefully everybody can get out there and start using these right away. Everybody, please be safe, be well, and be blessed. Thank you so much. I hope to see you soon.